Hyperacidity, also known as acid dyspepsia, is a condition characterized by the excessive secretion of hydrochloric acid in the stomach. This acid, produced by the parietal cells of the stomach lining, is essential for digestion, but when produced in excess, it can irritate the inner lining of the stomach and lead to discomfort, pain, and other digestive disturbances. The primary reason for this overproduction is often a combination of dietary and lifestyle habits, emotional stress, and certain medications. People who frequently consume spicy, oily, or acidic foods, or those who eat irregularly or skip meals, are more prone to developing hyperacidity. Drinking excessive tea, coffee, or alcohol, as well as smoking, can further aggravate the condition. Stress and anxiety, which stimulate acid secretion via the vagus nerve, also play a significant role. Sometimes, the condition may be triggered or worsened by a bacterial infection, particularly by Helicobacter pylori, which weakens the protective mucous lining of the stomach and makes it more vulnerable to acid damage. Medications like NSAIDs, such as aspirin and ibuprofen, or corticosteroids are also known to irritate the stomach and lead to hyperacidity when used long-term. Common symptoms of hyperacidity include a burning sensation in the chest or upper abdomen, especially after meals or during the night, a sour or bitter taste in the mouth due to acid reflux, belching, nausea, bloating, a feeling of fullness even after eating small amounts of food, and sometimes vomiting. In severe cases, patients may notice blood in vomit or black stools, indicating gastrointestinal bleeding, which requires urgent medical attention. To diagnose hyperacidity, physicians primarily rely on the patient's history and clinical presentation, though in certain cases, they may advise an upper gastrointestinal endoscopy to visualize the stomach lining directly and look for ulcers or inflammation. Tests for H. pylori infection through breath, stool, or biopsy samples may also be conducted. Treatment usually begins with dietary and lifestyle modifications, such as avoiding spicy and greasy foods, eating small but frequent meals, reducing alcohol and caffeine, quitting smoking, and managing stress through relaxation techniques. Medical management includes the use of antacids that neutralize stomach acid, H2 receptor blockers like ranitidine, or proton pump inhibitors like omeprazole or pantoprazole that reduce acid secretion. If H. pylori is present, a combination of antibiotics along with acid-reducing drugs is used for complete eradication. From an Ayurvedic perspective, hyperacidity is closely related to a condition called amlapitta, which is considered to be a result of an aggravated pitta dosha and impaired digestive fire, that is, Agnimandya. Symptoms such as sour belching, heartburn, nausea, and heaviness in the stomach are attributed to an imbalance in the body's Jataragni. Ayurvedic treatment involves Shodhana and Shamana therapies. Also, usage of Ayurvedic formulations like Avipattikara Churnam, Shankha Bhasmam, and Yashti Madhu, under guidance of an Ayurvedic expert, help balance the Pitta dosha and improve digestion. A diet consisting of cooling, mildly spiced, and non-acidic food is advised, and practices like yoga and pranayama are recommended to manage stress and promote digestive health. If left untreated, hyperacidity can lead to complications such as peptic ulcers, esophagitis, chronic gastritis, and even Barrett's esophagus, a precancerous condition. Hence, early management and lifestyle corrections are essential for preventing further damage and maintaining gastrointestinal health.